hotline number again is 785, and we will have Julie repeat that in just a moment as the health department's live is going active now. Thank you.
Go ahead. I understand this is a difficult time for everyone, so please continue to check in on one another and be patient. We have a strong community, and we will stay strong if we practice these good measures. I know I speak for everyone here at the EOC when I say thank you for your support and your cooperation. I'll now turn it over to Officer Kurt Muldrop, Assistant Director for the Riley County Police Department.
I too want to start off by saying thank you. I believe that we were able to hold off issuing this stay-at-home order as long as we did because of the voluntary and responsible compliance of the majority of our community. We also want to thank the local businesses who have done remarkably well at adjusting to the restrictions this pandemic has forced upon us. Many have implemented best practices to help reduce the spread of this virus. We ask that everyone continue to work hard at following the guidance of this new order and continue to support one another and stay engaged while maintaining proper social distancing. Those of us at the EOC have worked very hard these last few days, endeavoring to do the right thing for our community. We've been in regular communication with the MHK COVID-19 Clinical Task Force and have sought their advice, and we have their support. We have also looked at many stay-at-home orders already issued in communities surrounding us in an effort to craft one that best fits the needs of Riley County. We are well aware of the fact that the decisions that we make and that Julie puts out impact both directly and indirectly all of the citizens of Riley County. Please understand that these decisions also affect our friends and our family members, and we did not come to this decision easily. The Unified Command at the EOC are just that. We are unified. We are confident that the decision to implement the stay-at-home order is the right thing to do, and this is the right time to do it. We will continue to monitor the spread of the virus, and we stand ready to adjust it as needed. This is why we only made it effective for 14 days. We ask for your continued support and cooperation as we work through this. Again, thank you, and we'll take time for questions for any of us.
Could we start again with repeating the question and answer hotline phone number?
I will have to look that up. Yes, the question and hotline answer or phone number is 785-587-4526. Okay, 4523.
26.
Okay.
4526.
I'm going to repeat that. 785-587-4526.
4526. Thank you.
26. Or you can text to RL COVID-19 to 888-777. These are you can receive update text that way.
I have another question while Vivian looks for one on her feed, and that is, where can we find a list of the businesses that are considered essential for knowing whether or not people would be expected to go to work and whether or not their employers should be contacting them?
If you refer to the order that is listed on the Health Department website, it lists several categories and some specific ones in there, but that is the task that we're going to take as soon as we're done with this press conference, to start giving a list of specific named businesses within the community to help provide guidance for that. But that'll be a process as we go through each one.
Okay. This question is for Dr. Segen. No, not the mic. It's dead. And the question is, it's in regard to healthcare visits. Are prenatal visits considered essential services right now?
If you are seeking prenatal services, I would direct you to your gynecologist obstetrician to determine. I would say they're essential, especially one of the things that the task force has said is we do not want people to not seek health care because they're concerned about contracting the virus. Our hospitals are open, our clinics are open. We are really encouraging people to call ahead if you have any questions for your provider, and I would direct patients to their provider with those questions, especially regarding prenatal care.
This next question is about travel between counties if someone lives in one county but works in Geary County or Riley County, what's the advice for them?
Question is regarding travel between counties, basically. There are no travel restrictions in Riley County. We have not instituted any kind of travel restrictions. As I've said in the past, and it doesn't change with this order, there are no papers required to travel. I can't speak for other counties, but coming in and out of Riley County and moving through Riley County, we have no travel restrictions.
The next question, will USD 383 schools still be allowed to serve curbside lunches?
The question was, will USD 383 schools still be allowed to serve curbside lunches? And yes, they will still be allowed to serve curbside lunches.
Can you speak to how the order will apply to businesses or people who live in Manhattan but on the Potawatomi County side?
The question was, can we speak to businesses who live in Manhattan, or to residents rather, who live in Manhattan but are on the Potawatomi County side? Businesses. And we are working currently with the health department and the EOC at Potawatomi County to hopefully get some of the same language in their order as well. However, they will issue an order probably at a different time than we will.
Could you please remind us what the date and time of the stay-at-home order, when that is to start?
It is issued now. It will go into effect at 12:01 a.m. on Sunday, March 29th.
Thank you.
Will it be reassessed after the 14 days if it needs to be extended?
Yes, we'll evaluate. Oh, sorry. The question was, will it be reassessed after the 14 days? And yes, it will be.
Thank you.
For people who want specific guidance about what is open and closed, can you talk about resources for them, such as the hotline, website, email?
Sure. There's lots of different places you can go, such as our website, RileyCountyKS.gov. Click on the COVID-19 link and you can be directed to all of the orders and FAQ there. There's also our Facebook page. You can also email us at the Riley County COVID-19@gmail.com or the Q&A hotline at 785-587-4526.
Can someone talk about whether or not essential workers will need paperwork to go to their job?
The question is, will essential workers need paperwork? And the answer is no, they will not.
How does the stay-at-home order differ from how most people are already living right now?
Sure. The question was, how does the stay-at-home order differ from the way individuals are living right now? It doesn't differ a whole lot, other than there are some more restrictions to some businesses. Our message is the same, though. We still want you to stay at home unless you need essentials like food or you need to get out for health care.
Is there going to be any type of enforcement by our RCPD to make sure people are staying home and following this order?
Enforcement, the question is, what kind of enforcement will there be? That's a difficult question, and like the police department operates all the time, good judgment will be made in the process of this. The goal here is to encourage compliance. So we'll meet with businesses that we believe might be violating it, or we get complaints that are violating it, to encourage them, educate them, and try and gain compliance. I also want to take a moment to talk about, we've had questions about exercise. There won't be restrictions on exercise in the sense that we still want to encourage you to get out and walk. You can run, jog, things like that, but we're still trying to restrict the amount of movement you do. Keep the social distancing while you do that. A pickup game of basketball in the park, that's not a good plan because you can't maintain social distancing there and we're grouping together. So those are kind of the examples we're giving.
Thank you.
I think most of the questions coming in are specific to certain businesses. Can you address really quickly things like grocery stores, pharmacies?
The next question about what specific businesses will be closed. Again, we're going to be developing that, but it's going to be primarily textile type stores, businesses that are not providing essential functions for everyday life. Again, as I've been saying, that will not be grocery stores, that will not be pharmacies. Again, no reason to go out and panic buy. Those stores will remain open.
So included in the businesses that would remain open, would that also include restaurants that are providing carry-out and delivery and drive-through access?
Good question. Regarding whether restaurants, et cetera, will continue to be open. That has not changed as far as restaurants. They can do curbside, delivery, or takeout. Again, as long as they're maintaining the social distancing and best business practices within those stores.
Question about, should employees still report to work if they feel their employer is not following the guidelines, or what resources might they have?
Should employees report to work if they feel like their business is not complying with it? Obviously, we would encourage you to work these kinds of things out with your own business, encourage them to comply with the order. But obviously, if someone feels like there's an egregious violation there, they can contact the health department, they can contact the Raleigh County Police Department, code officers, and we can come and look at that. And again, we'll try and educate the business. We're going to be giving out those packets we talked about to help businesses understand what the best practices are. I will say I've been around and seen some of them, and a lot of the grocery stores, et cetera, have done a good job of putting in 6-foot distance while you wait in line for food, et cetera.
Okay, any final comments? Dr. Segen, would you like to say anything to the community, or any other folks, some final words?
I think as medical providers in the community, we just want to stress how we are working as a team to keep you safe and keep you healthy and decrease the amount of COVID-19 that comes to our community. We know it's here. We know we're taking it on as a group, and we're united in this task to help you. I encourage you to abide by the stay-at-home order and practice the social distancing and hand washing that we've talked about so much. This is one of the major things that has been shown to make a difference in this virus. I also want to encourage you, as Officer Muldrop mentioned, get out and exercise. You can do that safely, and it's good for your mental health. I know there's a lot of people that are very social, and this is a hard time for them. Find alternatives. I've talked to patients about the anxiety that this brings. Call people on the phone. Make it a point to touch base with people. We have older individuals that are not able to get out, and they are very vulnerable at this time, not just physically but emotionally. Make it a point to contact them and get in touch with them and know that they're thought of. This is a time we can come together as a community and make a difference, and I think that's what we want. The task force really wanted to feel like we could work together to be prepared from a medical standpoint, and making sure we had adequate PPE and adequate bed availability if necessary for whatever we need. And so that's why we're here and working together as a group. We appreciate all of your support in doing that. We cannot do this if we don't work together as a community.
Thank you for joining us today and listening to us and asking good questions. Those are important to us so that we can make sure that the right message is sent to everybody from one location. Thank you. We'll see you tomorrow.